Welcome dear students. I am Richa Shakya, Assistant Professor in Noida Institute of Engineering Technology, Pharmacy Institute, Greater Noida. Today I am here to deliver the lecture from the subject, that is the Human Anatomy and Physiology 2, and the subject code is BP201T, and this subject comes under the course of B Pharma, and this course comes under the Dr. APJ Abdul Kalam Technical University. So, today's topic for the presentation is physiology of the menstruation and the process of fertilization. So, in the previous lectures we discussed or we learned about the internal, external anatomy and the functions of the male and female reproductive organs, and then we study about the sex hormones, and now here we discuss about the process and the physiology of the menstruation and the process of the fertilization. So, now start with the introduction. So, basically what is menstruation? So, menstruation, it is shedding of the So, what is menstruation? Menstruation is a shedding of the slough endometrium with the mucus and the blood through the vagina externally following the failure of the fertilization or the implantation. It gives the most obvious external sign of the normal cycle. So, basically what is menstruation? Menstruation is the regular process in the female, that is the in every month there is a, if the fertilization or the implantation is not occurs into the endometrium layer, then the endometrium layer will shed off in every month, right? That every month means and the blood comes from the vagina. So, this process is known as the menstruation, right? So, if the menstruation occurs in regular means in every month, so it is a normal cycle, but due to some disease or due to some disorder, or maybe there is an implantation or the fertilization of the zygote into the endometrium, so at that time the menstruation will not occur. So, if the menstruation will not occur after the implantation, it is okay, but if the implantation of the zygote is not occurs and still there is a stop of the menstruation, so there is some disorders, right? So, if the menstruation is regular in a month, it is a normal sign of the normal cycle. The normal cycle is of 28 days. So, normal cycle is a 2 to 7 days, and the normal cycle runs in every 28 days, right? The cycle depends on the changes occur within the ovaries and the fluctuation in the ovaries of the normal hormones level that themselves controlled by the pituitary gland, hypothalamus pituitary ovarian axis. So, the normal cycle, the menstrual cycle begins at the puberty and lasts up to the 30 to 40 years until the menopause. So, what is menopause? Menopause is a condition at the certain age, means it is about the 40 to 45 or 40 to 50 years. In between that, there is a condition where the menstruation cycle will stop. So, this menstruation cycle is stopped after the certain age, it is known as the menopause. So, when the hormones changes and the egg production is stopped. So, when the menstruation cycle is stopped, the release or the maturation egg cycle is also stopped. Duration, so duration is about 28 days. So, every 28 days there is a cycle runs, right? It is about only 15% of the females. Average duration of the menses is about the 22 to 7 days. It is average, but sometimes the female suffering from the some disorders, so it will extend, but the normal is 2 to 7 days only. Ovulation occurs usually the day 14th. So the day start with the menstruation and the day is the 14th day. If the 14th day is, that is the ovulation day. ठीक, ovulation day it means the mature egg cell will comes out. It is a matured. So ovulation occurs usually in the 14th day of the menstruation cycle, 36 hours after the onset or mid cycle of the LH surge. LH surge means the level of LHA will increases. So during the course of the normal menstrual cycle, the ovarian goes to the 3 phases, that is the ovarian phase, ovulation phase and luteal phase. These are the 3 phases which runs during the normal menstrual cycle. So the follicular phase start on the first day of the menstruation and it ends with the ovulation, right? So means the day start with the menstruation day and it ends to the 14th day, that is ovulation day, right? So ovulation promoted by the hypothalamus, the pituitary gland release the follicular stimulating hormone. This hormone stimulates the ovary to produce around 5 to 20 follicles, that is the tiny nodules or the cyst, which beats on the surface. The follicular phase is often the longest menstruation cycle. So at the follicular phase is the longest cycle because it is about the 14 days, right? Because it starts from the menstruation to the ovulation day, right? So it is about the 14 days and it is the longest cycle of the menstruation cycle, and it is most variable phase, and it begins the first day and ends when the ovulation day, that is the day 14. The average length of the follicular phase is about 16 days. The rising of estrogen level during the follicular phase triggers the pituitary gland to release the LH and it start the process of the ovulation, and this ovulation when the ovary release the mature egg, means ovulation day means when the ovary release the mature egg. What is mature egg? This mature egg is ready for the process of the fertilization. So during this phase, if the sperm cell mix with the egg cell, that is a mature egg cell, the fertilization process will occurs. So this mature egg, the mature egg travels down the fallopian tube towards the uterus to be fertilized with the sperm. The ovulation phase is the only time during the menstrual cycle when the woman can get pregnant. So the fertilization, the process of fertilization, the chances of fertilization is about 80 to 90% on the day of ovulation, right? If this not done, if the fertilization process is not occurs, even the mature cell will bind with the with the egg cell, or it will not fertilize with some condition, or maybe the egg cell will not combine with the sperm cell, so the fertilization process not occurs. So if this is not done, the egg will die about 24 hours after it released. So egg will die only after 24 hours it released, so there is no fertilization. Then next one is ovulating phase. So ovulation phase is ovulating symptoms like a slight rise of basal body temperature, thicker discharge that has a texture of egg white. Ovulation happen at around the 14th day if the woman have the 28 days cycle right in the middle of the menstruation cycle in the last about 24 hours. If the female have a exact 28 days menstrual cycle, so the midday, that is the 14th day, is the ovulation day, right? So after a day, if the fertilization process not occurs, so the egg cell will die only or dissolve, it does not fertilized. Next is a luteinizing phase. So lasting phase of the evolution until the start of menstruation. The luteal phase is ruled by the progesterone, and this progesterone is a hormone, and the follicle that bursts the fourth menstruation egg stays on the surface of the ovary and becomes the corpus luteum. This structure releases the progesterone and the small amount of the estrogen. And the purpose of these hormones, means the purpose of the hormones, that is a progesterone and the estrogen, is to keep the lining of the uterus is thick, the full of nutrients, and in case of pregnancy occurs. If the lining of the endometrium is weak, so the implantation will not occur. So the progesterone and the estrogen will nourish the layer of the endometrium, that is the uterus layer. Now, if there is no implantation, the fertilized egg will in the corpus luteum will die and it reabsorb into the body. When it occurs, there is a drop of hormones that triggers the onset of the next period, starting from the cycle of the menstruation over again. The luteal phase lasts about 12 to 14 days, and it tends to stay consistent the cycle after cycle. At the beginning of this phase, most of the people will still feel energized and relatively symptom free. Now, next one is the uterine cycle. So, uterine cycle, it includes the changes in the endometrium layers of the uterus, and it is again divided into the three phases, that is a menstruation phase, proliferative phase, and the secretive phase. So, uterine cycle occurs into the endometrium. So, it is divided into the three phases. So, the first phase is a menstruation phase. So, menstruation is also called the menses, and menstruation bleeding or a period is the first phase of the uterine cycle. This occurs as a result of the degradation of the corpus luteum, which inhibits the release of the FSH and LH from the pituitary and thus prevent the proliferation of the follicular cells. Now, the menstruation flow offers the sign to indicate that the woman is not pregnant or it is not conceived or the fertilization process not occur. However, the bleeding might be occur during the pregnancy due to the several reasons. So, it is not necessary that during the pregnancy or after the conceive the female doesn't get their bleedings. Maybe there are some errors, there are some disorders, or there are some problems or complication during the pregnancy. So, there is some spotting will occurs, right. So, the menstruation follows the consistent of the blood from the broken capillaries, secretion of the endometrium glands, endometrium cells, as well as the unfertilized ovum or unfertilized egg. This phase usually lasts about the 3 to 5 days, but might range about the 2 to 7 days. In some women, the average is about 35 millimeters of the blood lost during the menstruation, but 10 ml to 80 ml is considered as a normal. A protein called as a plasmin is responsible for the prevention of the clotting during the menstruation. Because there is excess bleeding, if the clotting process does not occur, the person feels very low. So, there is a protein which known as a plasmin. The role of a plasmin is to clot the blood during the menstruation phase. The pain, there are some symptoms. The pain in back, stomach and upper thighs is the common during the first few days of the menstruation, and the severe pain is commonly observed in the adolescent girls. It is about 65% women observe the severe cramping into the abdominal area. Now, next one is the proliferating phase. So, this is the second phase of uterine cycle, where the estrogen causes the proliferation of the endometrium layer of the uterus. After the maturation of the follicle in the ovary, the they cause the release of the estrogen and the growth of the new endometrium called as proliferative endometrium. Means after the shedding of the endometrium, new endometrium will form or will grow. This phase is known as the proliferative endometrium. The endometrium becomes thick with the rapid cells multiplication, and it increases the mucus production cells as well as the blood capillaries. And this estrogen also causes the formation of crypts into the cervix that facilitate the secretion of the vaginal discharge, and this phase ends when the ovulation occurs and the level of estrogen declines. Now, this is a final phase, that is a secretive phase. So, the final phase of the uterine corresponds with the luteal phase of the ovarian cycle, which occurs after the ovulation. So, secretive phase occurs after the ovulation, means it is after 14th day, right? Ovulation is a 14. If the menstruation cycle is normal, so the ovulation day is 14. So, secretive phase occurs after the ovulation day. Now, the corpus luteum release the progesterone hormone, which release the particular essential to the uterus to make the respective for the implantation of the fertilized ovum. Then the endometrium becomes the oedematous, and secretory glands produce the large amount of watery fluid to assist the passage of the spermatozoa. And if the fertilization occurs, the fertilized ovum travels to the uterus through the uterine tube and become embedded into the endometrium layer. However, if the fertilization doesn't occur, menstruation occurs and the new cycle will initiate. Now, this is about the menstruation cycle. So, this is from the 0 day, means starting of the menstruation cycle, 14th day is ovulation and starting of the new one. So, there is a uterine cycle, ovarian hormones, androgen pituitary hormones, body temperature, and this is the ovarian cycle. So, during the ovarian cycle, you will able to see the structure of the egg, right. So, during this the egg will grow, right. This is a follicular phase. The follicular क्या करता है, what is the role of follicular? Follicular will nourish the egg. So, it will try to grow the follicles or the egg cells. Then after that there is a process of maturation of the this egg cell. After that 14th day the egg cell will mature, and their day is called as the ovulation day. So, after that the egg will release. So, this is the ovulation day, and this phase under the luteal phase, right. Then this goes to the corpus luteum, and if the fertilization doesn't occur, so again there is a start of the menses, there is a start of the menstruation cycle. If we talk about the hormones, so during the 0 to 14th day, sorry, 0 to this is about first day, so there is a estradiol, there is a E2 level is about this, right. This progesterone is very high. The antitree hormone, that is a pituitary hormone, that is a LH, and follicular stimulating hormone is high during the ovulation day, and body temperatures is high, right. These are the symptoms and these are the signs where the person can calculate or they get identify that this is a day of the ovulation. Now, this is ovarian cycle. So, this is about the summary of the menstrual cycle. Now, so there is a some common, this is about the menstrual cycle. So there is a some common problems or problems regarding the menstrual cycle. So first is the premenstrual cycle syndrome, that is it is known as PMS. So it is a hormone events before a period can trigger a range of side effects in the woman at a risk of including fluid retention, headache, fatigueness, irritability, and the treatments option include the exercise, dietary changes. So it is a premenstrual syndrome, means the person feels sick before the starting of the menses, right. Next one is the dysmenorrhea. Dysmenorrhea means it is a painful period, ठीक है. It is a tough that uterus is promoted by the certain hormones to squeeze the harder than the necessary to dislodge the this lining. The treatment option include the patient relieving medicines and the oral contraceptive pills. So the contraception pills also help to minimize the problems of the dysmenorrhea. Now next is the heavy menstruation period bleedings. So heavy menstrual bleeding means there is a heavy bleeding, right. So previously known as the menorrhea, it is left untreated, it can be cause anemia, because during the menses there is excess loss if the person is suffering from the menorrhea. So there is a excess blood loss, so maybe patient become the anemic. So this treatment option include the oral contraceptives, the hormonal intrauterine devices to regulate the flow. Next one is the amenorrhea, or amenorrhea is the absence, right, that is a dysmenorrhea and this is amenorrhea. So amenorrhea is the absence of menstrual period. This is considered abnormal except during the pre-puberty, pregnancy, lactation, post menopause, and it is possible to treat to include the low and high body weight and exercise. So if the person is suffering from the amenorrhea, it is a disorder. It is exceptional for the some conditions, that is a pregnancy case, lactation case, or there is some post menopause case, but this is a disorder in the normal age. Now fertilization. So basically fertilization process. So fertilization occurs in the multi-step process whereby the multiple sperms bind to the corona radiata, but only a single sperms usually fertilize with the egg, right. What is fertilization? Fertilization means the combination of the egg and the sperm, they get fused together, they form the fertilization. Then how the fertilization process will occurs? So thus after the intercourse the sperms will release and they try to penetrate the layer of the this corona radiata of the vagina, right, of the vagina. That means it try to penetrate, right, it try to penetrate. This is a layer, this is zona pellucida, right, this is a corona radiata. So they, if the sperm will enter or it will cross or it will penetrate, so the patches of the sperm into plasma membrane, then what happened at that time, the tail will remove and the head will go for the further process of the fertilization. So there is a part of acrosome. What is acrosome? Acrosome binds to the zona pellucida proteins, okay. This initiate the release of enzyme from the sperm along into the burrow through the zona pellucida, and this zona pellucida is binding the sperms and egg plasma membranes that initiate the calcium influx into the cell and release of the cortical granulose, and from the egg that block the sperms from the fertilization. Means when one sperm is entered, so there is a release of the cortical granulosum to block the other sperms to fertilize with the egg. So one time or only one sperm will fused. There is an exceptional case when the two sperms will fuse on the one time, that is the condition of the twins, right. So this is a process of fertilization. So thank you. This is all about the physiology of the menstruation and the process of the fertilization. Thank you.